Let's talk about children, Dr. Pomper, and skin cancer. We're hearing a rise, and not just in skin cancer like basal cell, but melanoma. What is going on?
Well, it's a real good question. It's hard to know what's going on, why this would be so. I would say that there are definitely more environmental irritants going on that could be causing a problem. I would say it's possible that the sun is stronger in people's exposure, even in areas where there wasn't as much sun. I mean, there's no doubt that there's a change in the temperature variation going on, and so people are maybe just not prepared for it. The fact is that little kids probably that's where most of the damage is, and it's very hard for mothers to always put on the sunscreen when they're just taking them out in the buggy and stuff. Like, I see it all the time. Oh yeah, well, I'm only going out for 5 minutes, and I've got the shade on the buggy, but of course the shade goes up when the kid cries and stuff, and there is sun exposure going on, and the sun tends to be pretty severe, and people are living longer also, so you see things that they might have had other problems that wouldn't have made it possible for them to live long enough to get these issues. Now, in terms of kids actually getting it, I think that you also have the idea that because we are so good at taking care of other medical problems, people who are may have some immune compromise in other areas, they're surviving and doing much better, and then this can come out.
How do you treat children with skin cancer? What is usually the choice of treatment?
So children with skin cancer, I think that the general consensus is to try to avoid radiation, because even though I don't think there's really any problem with giving the radiation, as long as you have a high level of an index of suspicion if something's ever going on in that area again. Everybody's general thing is that with younger patients, they don't want to give radiation if they can help it, because we really don't know totally the long-term side effects. And I'm talking about long-term 50, 60 years, that these kids may be around for 80 years afterwards, So if we can do it with something else, that tends to be the first choice.
So usually surgery or?
Yeah, I would say that we go for surgery, yeah.
Radiation therapy would probably be the last choice.
Correct.
Because
not that it couldn't be effective, but again, there's always that worry.
The long-term effects of radiation down the road.
Right.
What are the chances of cancer being caused as a result of the radiation therapy?
Well, many studies have been done, and it's when you're talking about treating skin cancers, it's really very, very rare. I mean, there have been some. It's very rare, and it's hard to know, because these patients are getting skin cancers anyway. It's like when you have a patient with Mohs surgery and they get what we call a recurrence. Is it really recurrence, or is it that was at the edge of the skin where everything was negative and the skin was damaged from the sun anyway, or the graft that they put in then developed it because it was going to develop it anyway? So it's hard to know whether there's anything that really happens with it, because we're giving a very high localized dose. But even if it did occur, I mean, it would be usually something very small that could easily be resected.